So we presented an update on the translational analysis of the AEGEAN trial, which was a perioperative trial investigating perioperative durvalumab and neoadjuvant chemotherapy versus neoadjuvant chemotherapy. We have seen that this combination has an effect on PCR and event-free survival. So here at ASCO, we presented data on the ctDNA analysis, and in particular, we presented data on those patients who were ctDNA positive after surgery, and these were the MRD positive patients. And overall, we have seen that 10% of the MRD evaluable patients were MRD positive after surgery, and these were mostly patients with advanced stages of disease, with N2 disease, with stage 3 disease. And we also have seen that these were patients who had an inferior outcome compared to patients who were MRD negative. So the disease-free survival was much shorter in the MRD positive patients compared to the MRD negative patients. And in addition, we also looked on genetic alterations of the MRD positive patients, and we found a number of mutations that are associated with IO response, including the KEAP1 mutation and the KMT2C mutation. We have seen with our exploratory analysis that we could identify a population of patients with a really worse prognosis. And in addition, we also could identify a group of patients with potentially a limited efficacy of immunotherapy. So from a clinical point of view, these are patients where we really need to escalate our post-operative treatment, whether this is chemotherapy, whether this is radiotherapy, whether this is a novel therapeutic concept. This is something we need to determine in future trials. What we have seen in our genomic assessment, that indeed in the 17 MRD positive patients, we found a number of mutations which have an impact on IO response, and these mutations included the KMT2C and the KEAP1 mutation. When we look on the efficacy of durvalumab versus placebo in this group of patients, we could see that there was a benefit for durvalumab versus placebo in the KMT2C wild-type patients and in the KEAP1 wild-type patients, but not in the mutated patients. Well, we have to be a bit careful because currently this is an exploratory analysis and the number of patients are really small. However, this is a signal that we need to confirm in prospective investigations, and I think from a clinical point of view, it is very important to know the mutation status also from these unfavorable mutations in order to monitor these patients adequately and potentially to escalate their treatment. This is a very difficult question, how we can optimize our adjuvant strategies in patients who are MRD positive after neoadjuvant chemoimmunotherapy, after surgery. And this is something which we really have to investigate in future trials. So there are a couple of concepts which we are pursuing. Number one, we need to talk about radiotherapy, which is also an opportunity of local treatment of patients with early stage non-small cell lung cancer. And we need to talk about novel treatment concepts. And we have novel compounds available like ADCs, like novel vaccination strategies and others. And I think these are strategies that we are going to explore in clinical trials in the near future.